Good afternoon. Good afternoon. Good afternoon, White Plains. Good afternoon, everybody. Thank you for taking some time out this afternoon, connecting with us, or watching this later at your convenience. But however you're doing it, thanks for connecting. And certainly, if I haven't seen you yet, if I haven't spoken with you yet, Happy New Year. Today is the 15th of January 2021, not that you needed to know that. I guess that's the teacher in me, right? Today I was hoping to be able to not only answer questions that came through via the questions at WPCSD.K12.New York.US, but also, if there's time, answer questions that might be in the chat. So if you do have questions, put them in the chat. I'll do my very best to get to them. You might want to wait a little bit because maybe I'm going to answer them with the questions that already came through this morning. Hi Liz, good afternoon everybody. So first and foremost, it is of course the weekend coming up is the weekend before Martin Luther King Jr. Day, and we here in the district, as you do as well, absolutely celebrate and honor the spirit, the memory, and the legacy of Dr. Martin Luther King Jr. Our children are doing some really fantastic activities, exercises, and explorations in the school district, and we're going to share them via Facebook and on the district's website anywhere we can. So keep an eye out for that, and happy to share with you as they come in. Good afternoon, Cheryl. We have a lot going on right now, in our country, in the world, in our lives. There's just so much going on. And I know on the minds of many of us and on the minds of our teachers and our children are some of the events that we've been seeing take place nationally throughout the last 10 months. Whether it be related to COVID-19 or whether it be related to civil, social unrest, whether it be related to concerns associated with the election. There's so much. There's so much, and dependent upon where you are and dependent upon your personal experiences, there can be so much more. Last week, our teachers did their very best to address issues in an age-appropriate manner with our children in classrooms throughout the school district, indeed throughout the state and the nation, related to children's questions associated with the attack on the U.S. Capitol. Parents and guardians have concerns, rightful concerns, that in classrooms throughout the United States of America, information being shared with children is information, factual information, age-appropriate information, developmentally appropriate information. All of these things, we as parents want to make sure that that's happening in our classrooms, and so do our teachers. Absolutely, so do our teachers. We also want to make sure that we create a space for children to be able to ask questions, wrestle with ideas, and think about things that are going on in their world, even though they might not be directly involved in them yet. And the yet is the big word. So as children are going through school and as children are engaging with topics, and they don't always have to be social topics, certainly, but there are controversial topics, and I just want to tell you that as a parent and as a teacher myself, teachers do their very, very best to handle very sensitive, delicate, sometimes controversial topics. Do we get it right all the time? No. Absolutely not. Sometimes we make mistakes, and when we make mistakes, we have to address those mistakes, and we have to address those mistakes with our children. I want to thank all of you. I want to thank parents and guardians who have reached out and commended our teachers for the way in which they've handled questions in the classroom associated with the attack on the Capitol, the social unrest. I want to also thank those parents who reached out with concern about conversations that took place in classrooms. We as teachers, we appreciate that feedback, and we also know when we make a mistake. When we make a mistake, we correct that mistake. So as we move into next week, that's just something that I want to keep there on our minds that we're thinking about, is we again will do our very, very best to support our children, to provide them with safe spaces to be able to explore ideas, talk about their thoughts, talk about their opinions, and we will do our very best to make sure that we leave out of conversations our personal opinions. Why? My personal opinion doesn't matter. The facts matter. What children are thinking matter, and allowing children the opportunity to grow in their thinking matters. So as we move forward into next week, if you have a concern as a parent or guardian, feel free to reach out to your teacher, your child's teacher. please do. If you in your home aren't watching TV and you're staying away from the news because that's the choice you're making for your children, that's okay. Let us know. We'll do everything that we can to support you. If you have a concern about a certain lesson that's going on, not just next week, but it could be a project 6 months from now, let us know. We'll do everything we can to support you and to support your children. It's a team effort. And as I mentioned, being there myself in a classroom of social studies, and I can remember vividly during the aftermath of 9/11. A lot of very challenging, a lot of controversial topics, important topics for children to be able to wrestle with. So thank you to all of our parents and guardians. Thank you to our faculty and staff members and administrators, and thank you to our kids. Every time I have the opportunity to sit in a classroom, or every time I have an opportunity to sit with and listen to our children, I am so amazed. And I shouldn't be amazed, but really I think it's proud. So proud of them, and proud of their thoughts, and proud of their opinions, and proud of their thinking, and mostly proud of their engagement with their world, because one day it's going to be their world. So with that, I will switch over now and talk a little bit more about COVID-19. Not that you want to talk about COVID-19, but here's the good news. We are coming into a new wave of this experience together in a pandemic. We are now in a time where vaccines are becoming more available. Vaccines in our communities, the opportunity to get vaccinated in our communities is expanding. We hope in the weeks to come it will continue to expand, and that's really great news. I'll talk about vaccines in a minute. Really important, daily screeners. Please make sure that you're filling out your child's daily screener if your child is coming to school that day. And that's that questionnaire, right? We're asking you, is everybody okay? Is everybody feeling okay? You are going to have the app available to you now. It's going to be coming out next week. It makes things a lot easier. You'll still be able to fill out the online version if you wish, but if you're going to use the app, it's the Smart Button app, and it literally is just a smart button. You press on the drop down, you indicate whether or not you're feeling well, and then you simply hold down the smart button until the circle completes, and that's it. That's the end of your screen process. That's the end of your reporting for the day. So thanks to Mr. Ronvelez, our technology department, for everybody getting that ready and rolling that out for us to be able to use beginning next week. Illness, again, we know that we have everything from the common cold to COVID-19 and everything in between that occurs in our households. Please make sure you're doing everything you can to monitor how your children are feeling, and if they're not feeling well, keep them home. Also, really important, if you're awaiting the results of a COVID-19 test, right? You're awaiting the results of a COVID-19 test, don't send your child to school. Keep the child home until you receive the results of that test. That will be so helpful. We have had a number of cases throughout the academic year where unfortunately there was an outstanding test that was that folks were waiting on at home, and as soon as the positive result came back at home, it then precipitated contact tracing that took place in school that could have been avoided. Now, everybody makes mistakes. I don't mean to judge, but what I am doing is just bringing to your attention, if you have an outstanding COVID-19 test in the home, we should all be staying home until we know what the outcome of that test is and that it's negative. New York State guidelines, health department guidelines have changed. They are now mirroring the CDC guidelines, which is good news. Why? Because the duration for quarantine periods has been reduced from 14 to 10 days. You're still going to self-monitor for signs and symptoms for the remainder of those 4 days, but after 10 days of no signs, symptoms, or no positive result in the test, you're able to come out of quarantine. That's fantastic. What else has changed? We are now doing a different contact tracing process as supported by the Department of Health, which we're grateful for, which is further reducing the number of children and or adults who are getting caught up in the contact tracing process and subsequent quarantine and isolation. We just now, a couple of moments ago, had two positive cases in 2 different facilities. You'll get that update later on this afternoon if you haven't already. And we know that the numbers associated with that contact trace and the subsequent quarantine and isolation is going to be further reduced from what it would have been months ago when we had had larger swaths of people caught up in the contact trace. We've taken the feedback and we've taken the advice. We've worked with the health department and the reopening committee, and we've changed the way we're doing some things. So now, and thanks so much, I know a lot of parents, guardians listening right now are going to go, oh, finally. Now in the cafeterias aren't going to be such a challenge anymore because now we have assigned seating. That's going to help us. Now when a positive case, contact trace moves into a cafeteria, it won't necessarily be necessary to quarantine and isolate the entire room. Same goes for school buses. So this is all progress that we're making and getting better at contact tracing. We hope that as time goes on, those numbers of positive cases will come down with the introduction and more prevalence of vaccinated individuals, again, come down, and getting better, of course, at identifying in the contact trace process, reducing the number of needed quarantines and isolations. So that's really good news. Lunchrooms, buses, the duration of the quarantine, all getting better in terms of a sense of less restrictive or less disruptive to what your child and you are experiencing on a daily basis. Testing. The district is going to be starting in earnest, small, screening testing, random, with folks who have indicated that they will participate or they're willing to participate in that random screening testing. This is going to start with adults, faculty and staff members, and we're going to begin next week. We have asked the state of New York for additional Buy Next Now rapid test cards to be able to continue this process, expand it as we are able, and continue this process throughout the remainder of the academic year. But Joe, those tests aren't totally accurate. You're right. Doesn't matter. It's going to help us because it's going to, number one, it's going to get people more acclimated to the idea that we're probably going to have to engage in rapid testing in the future for a period of time. Number two, it's also going to show us if we do have a positive case and definitely help us identify of that pool that's going to be tested if folks need to seek additional testing or advice from their healthcare provider. So even though it's imperfect, it will, again, be another layer of safety, another layer of security in terms of health safety, and we're looking forward to being able to move forward with that next week. We hope that the state of New York will be able to provide us with more Buy Next Now cards. We've not been designated as a microcluster. We're not seeing a lot of movement in that so-called microcluster designation statewide in the last several weeks. So absent that designation, we're still trying to be able to get that testing, working with Westchester County Department of Health as well as the state. Vaccination. A lot of folks were asking about vaccination. The governor is on now, but was just on talking about vaccination and saying that it would be helpful if school districts would be able to administer vaccines. Well, I'll tell you, Nurse Maggie Rasiopo, many of you know her. If the state of New York allows us to have vaccine, we will do them right here. We will become a vaccination point. Maggie and our team, we've been working with healthcare providers in the area and have alerted them that if that becomes available, if that's a possibility, we want in. That notwithstanding, we are also engaging, like everybody else in the region, in the process of being able to vaccinate all eligible folks in 1B. Faculty and staff members have the opportunity, as soon as they can get an appointment, to go. The district is doing everything we can to be supportive. So folks, regardless of what time it is, during the day, what day, it doesn't matter. If you can get an appointment over at the county center or somewhere else that's administering vaccines and you can go, we want you to be able to go. So everybody who's willing and able in our school district to get vaccinated is going to be able to do that. We're not putting up any roadblocks, and we're being as supportive as we possibly can. And we're putting it out there that if we can become a spot where vaccinations can be administered for folks in the school district, we will absolutely do that. We want to get this process moving just like everybody else. We want to get rolling, make sure that we hit those percentages because we believe that if we get to those percentages where so-called herd immunity takes over, that is going to help us. That is going to be the linchpin for us to be able to bring all of our children back, and that's where we want to be. So we're pushing hard for that, and I want to again thank Nurse Rasiopo and everybody on the health services team for all of their hard work. They've not stopped advocating for this. Sports. Really happy that we're going to be starting at the high school level with our off-season training that the children will be able to, student athletes will be able to engage with their coaches in a regularly scheduled manner. Those schedules are up on the district's website. And we are working again with Section 1 and everybody else to be able to identify and implement as many opportunities for our student athletes to engage in athletics as possible. I was just talking about the so-called high-risk sports this morning. You're not going to find anybody who doesn't want kids to be able to play basketball, football, wrestling, hockey. We do. I want them to play. We want them to play. It's not up to us. It's up to whether or not the Department of Health has the data to support being able to put those programs back in play. So as soon as we have more information on that, we'll share it with you. But know that everybody wants our children to be able to play, just like we want our children all back in school. It's just whether or not we're able to achieve that goal and still make sure that we're attending to the health and safety requirements that we need to keep pushing us through. We have come a long way together. We are so far from where we were last March. It's been a long time. There's been a lot of loss. There's been a lot of stress. But we have really come a long way. And this next piece, I hope, is going to make folks smile. We are absolutely committed. And again, it's only January, right? But we're absolutely committed to making sure that we have celebrations for our White Plains High School commencement and our Highlands moving up ceremony in June. It's not going to be at the county center. That I'm almost 99% sure. Why? Because the county center will probably be a vaccination hub still, and it will probably also still be set up for a field hospital. But we are planning, and thanks to Principal Martinez, Mr. Russo, and the team at the high school, thanks to Mr. Spatafor and the team at Highlands, we are planning right now to have everything in place to be able to have in-person commencement and moving up exercises in June. That makes me smile. It makes me happy. I hope it makes you smile. I hope it makes you happy. But Joe, is it going to be different? It may be different. We might have to space it out. We might have to have more than one ceremony. It's definitely going to be different because it'll be outside. But nevertheless, we are planning to bring our kids together and to celebrate their accomplishments and to celebrate them moving up and to celebrate them moving on and to do it in the style and fashion that we are used to. So more will be coming on that. We're also thinking about all those end-of-the-year events because it will be here before we know it, and we want to make sure that our kids have all of the fun activities at the end of the year in every form and fashion that we can provide it to them. Everyone did a great job last year. There's no question about it. The people who put together our end-of-the-year activities for our children did an amazing job in a period of time that no one could have ever thought about. We have extra time to plan now. We're doing that, and we want to be ready for those celebrations when June rolls around. Communication remains really important. If you need something, if your child is struggling with anything, please reach out to your child's teacher. Please reach out to the principal. Reach out to somebody here in the district because we want to be able to help you. We have seen all kinds of different challenges over the last 10 months. So if you're struggling with something at home or you're thinking about something that concerns you with your child, please do not think you are going to be the first one. You're not. You're not. Whatever it is, whatever issue you're having, whatever's keeping you up at night, stressing you out, let us know. Chances are it's something that we've encountered before and we'll be able to support you. So please make sure you are continuing to reach out. And for those of you who do reach out, you share feedback and you share recommendations and snippets of the good, the bad, the indifferent, that's helpful. All of that feedback has been helpful and it will continue to be helpful. So thank you for that. Wellness. Keeping ourselves well, trying to do our best to make sure that we're taking care of ourselves, to avoid that COVID fatigue, which is absolutely real. We all have it to varying degrees. Sometimes it crops up at one point in time or it goes away for a little bit. I can tell you when the vaccine started becoming available for our faculty and staff members here in the district, I felt a new sense of energy. I felt a new sense of positivity when faculty members started coming back and telling me and showing me their stickers that they've gotten their first dose. That re-energized me, helped me push that fatigue out of the way a little bit. But it's still there, right? So we have to be conscious of it. We have to make sure that we're taking care of ourselves and those around us so we can keep getting toward the end of the tunnel, which we see the light now. mental health. We have a lot of services available, including virtual counseling and virtual therapy sessions that are available if needed for folks who might be struggling with feelings of depression or isolation, feelings of loneliness. If your child is feeling those types of emotions, if you're witnessing changes in your child's behavior or mood, of course, reach out to your child's pediatrician, but absolutely let us know as well. We might be able to help. Chances are we can. High stakes assessments, there's still no word yet on the assessments for grades 3 through 8. We are advocating fiercely that those assessments be waived by the federal government this year again. It is definitely not the time to be putting high stakes standardized assessments in front of our children. Hopefully we'll have some more information on that in the coming weeks when the new administration and the new Department of Education comes in, and we can start communicating with. So there's no Secretary of Education right now. As many of you know. So hopefully in the next couple of weeks we'll be able to begin acting or speaking with the acting Secretary of Education and make a determination as to whether or not we're going to have those assessments or whether or not they'll be able to be waived for the state of New York. And then finally, website. Please make sure you visit our website. All of the information that we share and send out into the community is available on the website. We try to put it right on the homepage, everything to do with COVID-19, communication, social and emotional well-being. We try to keep all of those resources linked right on the homepage so you can get right to it and not have to fish around. Also, your child's school, if you go to your child's individual school or schools, their websites and their homepages are full of useful information, including all the contact information that you might need to be able to get the answers to any questions. Finally, if you can't find anything or you can't find something on the website, just reach out. And many folks reach out to us right here in the central office and we'll be happy to help you. All right. Let's go with some questions. What do we think? Good afternoon. Oh, wow. Good afternoon, everybody. All right, Jones getting vaccinated today. Wow, it's great to see 108 of you. It's great to see you. Thanks for being here. The first question is, I want to know if we are going to change and see the younger kids coming into school more often. Maybe we're going to reevaluate. Are you going to reevaluate to go to a half-day schedule? We want to get kids in 5 days a week. Thanks for your question. We want to get all of our children in 5 days a week. We've looked at the half-day schedule actually several times. We've looked at the so-called morning afternoon. The morning afternoon actually ends up, because of transportation, logistics, getting into classes, lunch that needs to be served, all of those things, plus the services that our children need to have during the course of an academic day, actually ends up being less instructional time when you break it out into half days like that. So half days is not something that we've thought would be advantageous to our kids. We do know that more time in the classroom, so more days in the classroom, is where we want to be. I think the key to that right now, the fastest key to that right now, is vaccinations. Vaccinations coupled then with screening testing, I think gets us there faster. We all want to be back to that 5 days a week, or certainly more than 2 days a week at the elementary level before the end of this academic year. We're pushing for that. I don't have a timeline on it. Much of the challenge that we have, actually all of it, is related to density and the ability for us to bring children in and put them into the classrooms and still adhere to the health safety standards. So as soon as we're able to, we definitely will. When will students be attending more days? Will there be a phased-in approach? Well, children right now we're in the process of bringing more children back right now. We're moving from the high school level down. You'll remember at the high school, middle school level, our children are in person 1 day a week. We're now in the process of bringing children in, or attempting to bring children in more often at the high school and at the middle school levels. What will that look like? The principals and their teams are working on bringing in groups of children on Monday, Tuesdays, and Thursdays, Fridays. So children would then be attending school twice a week in person. That a lot of work has gone into identifying open areas and schedules where children who have elected to be, or parents and guardians who have elected their children to be fully remote, we can take advantage of that reduction of density in the classes. So right now we're focusing on the high school and middle schools, and we're working our way backwards. We do have situations at elementary levels where we are bringing children back in more often. Principals have been working with parents and guardians on that. So while it's not widespread right now, right, for every single child, we are getting more children back into the classrooms more often, as we had indicated that we wanted to do. And we'll continue to do that. Simultaneously, vaccinations, simultaneously ramping up and getting screening testing made available. All of these things working in concert, I think, equal us getting back into the classroom every day, which is where we want to be. Somebody asked me a question, well, what about September? In my mind right now, September, will we be wearing masks? Yeah, we probably will. Maybe we will. Will we be back in school every day? Yeah, that's where we want to be. That's where I plan to be, and I know that's where you plan to be. In June, if you could come back, if you could bring children back every day beginning June 1, based on the requirements from the Department of Health, would you do it? Yeah, we would do it. So, in your mind is where my mind is, where our teachers' minds are. We all want to be able to do this, and that's we're pushing to make it happen. Another question here, is there or will there be any discussion of, same question, elementary children more than 2 days? What's being done to help the social and emotional health of all of our children, but also particularly for students with special needs? Thanks for the question. There are a lot of opportunities for support, individualized support for children, not just students with special needs, but all children that's available at every school. And without going into the particular programs, let me say it's everything from the regular connections and just making sure check-ins and making sure you're okay, to actual therapeutic and counseling sessions that take place on a scheduled basis. If you have questions about what could be available for your particular child, please reach out to your child's principal, or you could certainly reach out to us and we'd be happy to help you. I would like to know if there will be learning and social accommodations or adjustments for next year's first graders. And there's a long paragraph there, but basically what it says is the children have been through a great deal. Many of the children have never had the chance to make that first school friend or see their friends smile on the playground because of wearing masks, so on and so forth. Yes, really, really challenging. We will be, of course, attending to all of those needs that our children have, and making sure that regardless of what that date is when we're all back in, all together again, that again, the first thing we're attending to is making sure that the kids are okay, and reintroducing and reacclimating to the school process on a given basis. We know we have children who parents and guardians have chosen full remote, have not been in school at all. They've been engaging in their studies fully remote all year long. Will there be a acclimatizing process that needs to happen? Yeah, absolutely, and we'll be prepared for that and speak with you more about it at the school level when we get there, and particularly, of course, and again, this is a superpower of teachers, right? Talking to their classroom, the parents and guardians of the children in their classrooms about what they're doing, how they're going to do it, how we're all going to work together to support each individual child. Are there any plans to lessen the iPad time when the students are in person in the classroom? Can children listen to the teacher rather than Zoom? I think, yeah, I think that's definitely a great question for the classroom teacher, or whatever your child, however your child is experiencing that. For some children that's not an issue. For some families, it's more of a parent, a guardian issue than it is a child issue, so on and so forth. So if there's something that you feel needs adjusting, definitely reach out and speak to your child's teacher. How can parents help their schools so more in-person instruction can occur? I think I touched on that a little bit right at the beginning, in just making sure that we're doing everything we can at home to not bring COVID-19 to school. That's really helpful. The stops and starts of in-person instruction are super frustrating. Many parents, guardians, myself included, it's just, there's been a lot of it, and it's hard on the family, it's hard on the schedule at home. So everything that we can do to reduce that schedule change at home by making sure we're monitoring our own personal health situations would be really appreciated. Additionally, if you travel, if you're going to visit somebody somewhere, making sure that we're adhering to the requirements for travel, and that we're absolutely certain we're not COVID-19 positive before coming back into the facilities is very helpful. Will spots be opened up for hybrid learners who have identified by the teachers, who have been identified by their teachers as at risk? Are these spots available? They are opening up right now, and teachers and principals and support staff members are communicating with families to get children into school as quickly as possible, as often as possible, to be able to attend to those emergent situations that are occurring. Can you please combine Monday, Tuesday, Thursday, Friday cohorts at the high school? I think I alluded to that just before. That's what we're looking to be able to do. So more will be coming on that from the high school, and certainly feel free to watch just this past week's reopening committee meeting for some more updates on that plan. It seems like many of the grade-wide quarantines are from the lunchroom. Is there any consideration to allowing each cohort to eat in their class? So I think we're attending to that as well now, also with being able to identify where all the children are sitting and who's eating where. And so if there's a contact trace situation, the entire cafeteria is not getting caught up in the quarantine and isolation requirement. I've been receiving an email about the COVID-19 testing consent form for my child. Do I have to fill the form out even if my child is on remote? No, you don't. Thanks for the question. But you may want to consent if you plan on, at some point in time, your child coming back in person, and you want your child to be able to be in that pool of consent for random screening testing. Have you started looking at the plan for the fall? Do you expect school for students to continue to be socially distanced? Are we planning for a 5-day week? We're planning for a traditional week of in-person instruction. I do believe that there will probably still be health safety standards that'll be in effect. I don't know that they will be what they are right now. My hope is that they will be reduced so that they will not be impacting density, because we will have hit that critical mass point for vaccination, and we can be confident, or testing, and we can be confident that we have the appropriate measures in place to come back into the buildings every day, all day, all people. When will vaccines be available for our children? That I don't know. It's important to remember that the vaccines that are available right now are only available on an emergent basis. They've not been approved by the Food and Drug Administration, and they've only been approved for humans 16 and older. So in terms of vaccinations for younger children, I don't know. I don't have the answer for that. When we do have more information on that, I'll be happy to share it with you. Are White Plains teachers going to be provided a distinct way to get vaccinated, or will it be like fend for yourselves? Talked a little bit about this. We asked for vaccine, so we have that ask out there, and at the same time we've made arrangements to support all of our faculty and staff members so that whenever they can get an appointment to get their first and second course of vaccination, they can do so whenever, and we'll support them in being able to do that. With New York State opening up access to COVID-19 vaccines to pre-K to 12 teachers and staff, can you please walk us through the logistical arrangements that are being made? So that I think I did. I think I've answered this question. The arrangements that are being made at the district level are that faculty, staff, administration, support staff members are encouraged, if they are able and willing, to participate in the vaccination program that's available. Anytime that they can secure an appointment to get vaccinated, they're able to do that. We've also been working and coordinating with our local healthcare providers to express our distinct interest in being a vaccination site. So if we are able to get the vaccine, make it available, and be able to vaccinate here, we would do that as well. Will the White Plains school community be provided with information on what percentage of teachers and staff in each school have over time been administered the vaccine? So much like all healthcare information, there are laws that protect the privacy of every individual in the school district. What I do expect that we will be able to find out in the future are rough percentages, right? So for folks who are willing to share whether or not they've been vaccinated, we should be able to have a percentage, an idea of the number of adults within the entire school district and or in individual schools that have been vaccinated. So again, we wouldn't be able, for instance, you wouldn't be able to say like, I'm your child's teacher, Joe Ricca's your child's teacher, is he vaccinated or isn't he vaccinated? That's not information I'd be able to provide to you, unless, of course, I said to you, yeah, I'm vaccinated, just like, flu shot. And any data point that we can share, we absolutely will share. There probably will be information coming out from the state, and maybe even county government in terms of overall percentages of vaccinated individuals countywide, regionally and statewide. Will there be an opportunity for families and individual classes to learn whether their teachers and teachers' assistants have received the vaccines? So again, not on an individual level unless that an individual shares that information with parents or guardians. Some people are very, and this is great, this is fine. Some people are very private about their whether or not they're making a choice to get a vaccine, or whether or not they can get the vaccine. So it is a private situation, and we of course would respect that. But overall percentages, we would be happy to share whatever we have, as long as it wouldn't be disclosing personal, confidential, medical history or information. All right. I'm going to go into the feed. I'm going to answer as many questions as I possibly can. And again, thank you all for jumping in this afternoon. Thanks for sending your questions in ahead of time. And let's see. All right, Joan Cruz getting vaccinated today. Great. That's great news. Will there be an email about the new app? Yes, Nikki, there will be. There will be an email that will give you the information related to the app that's available. That'll be coming out next week. Really simple. Once you download it, once you load it onto your phone, really simple to use. The key, though, and this is the trick, is you don't press the big button. You hold the big button until the circle completes, and you get the thumbs up that your survey's been submitted. That's important. Thanks. This generation has gone through and experienced a lot. Some may think that they... Mrs. Torres has handed me more questions. This generation has gone through a lot. Some may think that they will have the least knowledge on things. Oh, I think this is... Yes, I agree with you. Yes, I agree. This generation of children, of young adults, they are learning a lot. They are progressing, and they are going to be strong, for sure. Hey, Alex, how are you, Tiger? Good afternoon, everybody. Hockey, 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 Anne-Marie. Yes, hockey. I know. Is there a season this year? We don't know yet. We certainly are hopeful that something will be able to be reclaimed for the season, but we have to wait. We have to wait on DOH. And I was talking to someone this morning, and I think the hardest part is not having an answer. Even if the answer is no, I think our student athletes, I think our coaches, I think our parents and guardians would appreciate that. The hardest thing is the waiting. So we're going to see if we can get some more answers, and knowing how committed our student athletes are, and moms and dads are to the sports also, we will get that information to you as soon as we can. Advocating for high stakes assessments, which is great. Can you talk to high school exams? Surprised to learn my high school students having midterms. Stress levels really high. Thanks, Lisa. Yeah, and certainly, again, reach out to your child's teacher. We haven't canceled midterms. We're not going to cancel finals. We think it's important to still have those assessments. Of course, things may be different. We may have changed the way we're approaching them as than in years past. We understand that stress levels are high, and each child is unique. So if your child's experiencing higher levels of stress and testing anxiety, please do communicate that, and we'll try to do everything we can to help. It's a great point, and I do appreciate that, Lisa. Thank you. Hi, Suzanne. Yes, assessments including Regents. We are advocating that we take the same approach with the Regents exams that we took last year, and so that students would have one less thing to worry about in terms of those high stakes examinations. But remember, they still had to successfully complete the class, right? So they had to pass their regular classroom assessments too, and that worked out. So hopefully that'll be the case this year. Hi, Lucia. Will students that are switching from full remote to hybrid go through some type of transition orientation? I'm especially interested in knowing if this would be offered to Eastview students. Yeah, so anything that we need to do to support children as they're sort of re-entering face-to-face, in-person instruction, we'll be able to do that. The surprising thing, though, in many instances with our kids, I talk to them in the hallways or when I get a chance to see them. They're amazingly resilient, and figuring out how to slide in and out of these scenarios is something that I've watched them do with really just great dexterity. So we will have supports available, but hopefully also the kids will be able to act. The biggest piece, I think, is getting back together socially with their friends. They want to be with their friends. Who doesn't, right? So trying to get that opportunity available to them as quickly as possible is the goal. High school increasing days starting when? Thanks for the question. I don't have an exact start date. I know Principal Martinez is going to be communicating with the White Plains High School student community and parent guardian community in the coming days. But Andrew, please feel free to reach out to Emerly. I'm sure he'd be happy to talk with you. And as soon as he has a date, I know he's excited to be able to share it as well. Hi Harsheen, second grade mom. Instead of intermittent Zoom sessions, can we have continuous Zoom rooms so kids don't have to keep track of all the different Zoom logins at all different times? Many schools in New Jersey have adopted a full day Zoom room. Kids turn off their video. Thanks for the question. We've heard all different approaches to Zoom. I'm glad that we are using, and I know you are too, synchronous learning opportunities for our children. Do they have to keep track? Yeah. Is it hard for second graders? Absolutely it is. I can tell you for my first grader, it's tough. And we have to set up a schedule for him to follow and to make sure that there are reminders and all of that. We've not talked about having just a singular broadcast Zoom that's on all the time. We don't know necessarily that would be advantageous. In fact, it probably in a lot of ways doesn't even mirror the actual in-person classroom environment. Oftentimes in an in-person classroom environment, children are off. They are working, independently. They're doing guided practice. Perhaps they're working, in a smaller group setting. So it's not always just on all the time. And I think what our teachers, and I think, thank you for this, teachers. I think what they've tried to do is in every way possible try to recreate that typical classroom day experience for our kids. But thanks for the question, and certainly always happy to consider anything. Hi Andrea, I'd love to see more clubs for kids. Yeah, sure. There are clubs. There are academic clubs available. If you have questions about the clubs at the high school level, you can reach out certainly to Dr. Natasha Freeman Mack, and at the middle school level, you can reach out to either Principal Rodriguez or Principal Spatafor. Hi Kay, you were late. It's okay. It's being recorded. You can watch it anytime. No, it's good. Let's see here. For next school year, will you find space to house the kids 5 days a week if distancing still must be in effect? So that's a great question. The space is the space. I don't think that's going to be the case. I think we are going to be back in school 5 days a week, all the children. I think there are going to be children and parents and guardians who are concerned about coming back in. COVID-19 won't be gone. But for all intents and purposes, I think we're going to be in a much different place in September than we were this past September 2020. So I really do appreciate that question. And while nothing is certain, and I can't predict the future, I can tell you that all systems are pointed to 5 days a week, athletics, all of these things, because the vaccine, if everything moves, the folks who are willing and able to be vaccinated will be, and we need to be back in school. These are serious steps that we took for a serious time, but we all know that it's not sustainable. We can't stay like this. We shouldn't stay like this, and quite frankly, we shouldn't. If you want to stay like this, okay, I appreciate that. I don't. And we have to push. So September 2021, I am confident that we will be back. And if I'm wrong, I'll say I was wrong. But today, I want to be back in September 5 days a week, all of our children. Yes, it is absolutely unlikely that all children will be vaccinated by September 2021. That absolutely, it is unlikely that our children will be vaccinated. And quite frankly, for moms and dads out there, parents and guardians, are uncertain as to whether or not they would vaccinate their children, right? And that's okay too. But for the adults, for the faculty staff members, for the administrators, for the support staff members, those folks who are willing and able to be vaccinated, they should be able to be vaccinated. Thank you, Mrs. Torres. That's what we need to be doing right now. What are the plans for starting random COVID-19 testing in our schools? Yeah, I talked about that a little bit at the beginning. Right now, we're going to start with the adults who have consented and do random tests. That's going to start next week. They're going to be small samples, so they're not going to be these huge disruptive sample testings, but we are in the process of beginning that. We're also, we reached out to the State of New York Department of Health and the Westchester County Department of Health, trying to get some more access to those Buy Next Now rapid test cards to be able to administer those tests, even though we're not designated as a microcluster right now. Thanks for your question. Based on the current clinical that was the one we were just talking about. I think I hit all of the questions. I think I've already had to make alternate plans in case it's not what I want, but I really need solid information. Thanks, Juliana. I'm happy to talk with you personally if you want to talk about your thinking about alternate plans. I think you were talking about alternate plans for the fall of 2021. Listen, I wouldn't fault any parent or guardian for making plans. Nothing's ever certain. We've learned that the hard way, right, last year, for sure. But I can tell you that I think, even more than I feel, that we are in a way better place in terms of being prepared to open again, are we wearing masks? Might there be, social distancing 3 feet or 4 feet or something in the classroom environment? Could there still be those types of hand sanitizer, wash your hand, all that, temperature taking, all that? Is that still going to be in place? Maybe, probably. But in terms of a reduction in the density of public schools, is that going to be in effect as it is now? I think that will probably be changed. We all want to, as soon as it's safe to do so, as soon as we have the appropriate vaccine percentages in place, I think we all know that we want to be back full time. All right, friends, thank you so much for taking the time this afternoon. I really do appreciate it, as always. If you have any questions or concerns, you can reach out. Our reopening committee is now meeting every 2 weeks. I'm hopeful that I'll be doing these Q&As about every 2 weeks, maybe more if we need to, if we have new information that we need to share. And then, of course, in the interim, we'll definitely share any new information that we have with you. Always available to you. Thanks again for everything that you're doing. Thanks so much for supporting our children and supporting our teachers and our school district. Have a wonderful weekend. Stay safe, stay healthy, and stay WP proud. Thanks, everyone. We'll see you soon. Bye-bye.